Michael, of course, millions of South Africans have medical aid, but it's just a small fraction of the population, isn't it?
It is, Shahan, and I was actually just looking at our map, and I was just thinking of where you're from. In fact, you're from KZN, and take a look at these figures for eThekwini. These figures basically look at the amount of residents which have medical aid coverage, and then the percentage of residents who use a public facility as their first port of call when they're ill or when there's an emergency. eThekwini providing some interesting insight. Just over 1/5 of residents there have medical aid coverage, and nearly 3/4 or 73% will go to a state hospital or a state clinic when they are ill. Just giving you a sense of the reliance on public facilities. Let's compare that to Tshwane, for instance. That city seems to be doing rather better. A third of residents there with medical aid coverage, and just over half relying on public facilities when they are ill or when there's an emergency. Going down the coast, Johan, it doesn't get much better, I'm afraid to say. This is one of the heaviest reliance on public facilities. Less than 20% in Buffalo City have medical aid, and again 74% using state hospitals or clinics as their first port of call or for their first consultation. Let's take a quick look at one other city very quickly, and that's Nelson Mandela Bay. Again, 22% have access to medical aid. 2/3 of residents there relying on state hospitals or state health care. So again, just a heavy reliance on the government and on state funds to take care of South Africa and to take care of people who very often are desperate for some kind of health care.
Thanks so much for that, Michael. Appreciate it. We'll see you, of course, later on the channel.